Kia ora, my name's Janet. I'm one of the diabetes midwives. So your doctor has recommended that you consider using insulin to manage your diabetes in pregnancy. You're probably thinking, I can't do that, but I'm going to show you that it's relatively simple and that you will gain confidence really quickly. Let me show you first the pens that we use. These are insulin pens. They make giving insulin very, very easy. Here at Auckland City Hospital, we have a convention of always using fast-acting or clear coloured insulin in the blue pen and cloudy coloured insulin or slower-acting insulin in the grey pen. So we give you one pen of each colour so that it makes it easier to keep the insulin separate. We have two companies that supply us with insulin. The insulin is fairly similar in its actions. They come with different pens. So these are the pens of the other company. Once again, we try to put the cloudy coloured insulin, the slower acting insulin, in the grey or silver pens, but you might be lucky enough to get a choice of colours for the other pens. So I'm going to show you with the first company how to load these pens. They're similar but just slight differences. And it's very important that the pens suit the specific insulin. They're not interchangeable. So I'm going to load the clear coloured fast-acting insulin into this blue pen. Remove the cap, it pulls off. You have to give it a firm twist to take the cartridge holder off. Before you put the insulin into the cartridge holder, just check that the clear insulin's clear, that the cloudy insulin is cloudy. So I'm meaning that they're not discoloured. Also check that they're within their use by date and also check that there isn't any damage to the glass cartridge. The cartridges go into the cartridge holder with the coloured end down and the coloured end pokes out the end. When you rejoin the cartridge holder to the insulin pen, give it a good twist and make sure you hear it click. Okay, now we're going to put a needle on the end of the cartridge. It has a little tear tab, a small spike on the inside that goes onto the cartridge, and then twist until firm. Remove the cap and there's your needle. Very, very tiny needle, very sharp, very fine. Unlike the blood testing machine, this you won't even feel it. So it often makes you feel very anxious to think about giving the insulin, but when you go to give it, you're not going to even feel it. At the end of the insulin pen, there is a window with numbers. These dial up all the way to 60. So with this pen, it's got a locking device on the end. You have to unlock it and then you can turn the device all the way up to 60, although we're probably going to start on a lower dose. So we will guide you in what dose to use and you just dial it up to what we suggest. As you gain confidence with using the insulin, you'll have confidence to use a little bit of a range that we discuss with you. So when you put your new cartridge into the pen and your needle onto the end, you need to make sure that insulin's going through the whole system. Sometimes there's a little bit of air in the cartridge. So if you hold the pen upright and eject 3 or 4 units of insulin, so just give it a little squirt. Nothing came out, so I'm going to just unlock the pen, push another 3 units through. I'm going to put 4 units through this time. And there we have a little bit of insulin seen at the end of the pen. So this is just to ensure that when you give yourself your insulin, you're getting actual insulin and not air. Be careful when you recap the pen. And when you finish giving your insulin, you just snap that lid back on and it's all ready to go. With the cloudy insulin, which is given before bed, it's the same procedure. Undo the cartridge, the coloured part goes in first. You might be able to see that the cloudy insulin is a little bit of a particle mixed with a fluid. So when you haven't used it for a little while, it separates out. It's important to put it together and make sure it clicks. Put the needle on the end. We recommend that you change the needle every 2 or 3 days, but you can change it every time you give the injection if you want to. With the cloudy insulin, it is important to just give it a gentle little mix before you give it, just to mix the particles with the fluid, the solution. Not too vigorous, but make sure that it's mixed together. The insulin that's in your pen is stable outside of the fridge at room temperature for up to 28 days. But your spare insulin must be kept in the refrigerator, and we suggest that you put it in the main body of the fridge, not in the door because it's not quite cold enough, not on the top shelf because it's a little bit too cold, but in the main body of the fridge. If the insulin is exposed to high temperatures or freezing temperatures, don't use it. Let us know and we'll get you some more. So that's how you put your insulin together. With the other company, it's a similar system with dialing up the insulin at the end. Remove the cap, twist. If the plunge is coming down, just push it back gently. So this is a blue pen, so I'm going to put the faster acting clear insulin in here. I'm going to check that the cartridge is undamaged, that the insulin is clear, that it's within its use by date. Once again, actually with this company, the cartridge is the same shape as the cartridge holder. So, and just make sure it clicks again. And the needle just goes on the end as usual. Have a go.